afternoon, everybody. It is Tuesday, April the 7th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am joined today by my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, and Dr. Brenda Weiss from our Office of Public Health. So since our briefing yesterday, we have had 160 new positive cases of COVID-19 in Montgomery County. This brings us to a total of 1,294. These positive individuals are from 38 municipalities, none of which are reporting their first cases. This keeps us at 59 of our 62 municipalities that are home to individuals with COVID-19. Today, these individuals range in age from 17 to 101 years old. And of course, you can check our county map at montcopa.org/COVID-19 for an update account within each municipality. The age brackets today, we have one person between the ages of 10 and 19, 22 people between the ages of 20 and 29, 26 people between 30 and 39, 25 people between 40 and 49, 34 individuals between 50 and 59, 16 between 60 and 69, 13 between 70 and 79, 15 between 80 and 89, 7 between 90 and 99, and one person between 100 and 109. There are 86 females and 74 males. 12 are known to be hospitalized, and we have 148 that we are not sure of their current location. Unfortunately, I am saddened to confirm that 5 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 32 deaths. We have a 94-year-old male from Upper Gwinnett Township, an 80-year-old female from Norristown Borough, a 78-year-old female from Springfield Township, a 75-year-old female from Upper Marion Township, and an 86-year-old male from White Marsh Township. 3 of these individuals passed away in the hospital, and 2 of these individuals passed away at home, and that's all the information that I have today on these individuals. And of course, as always, we do express our condolences to the friends and loved ones and families of these folks. We continue to have open hospital beds in all of our Montgomery County hospitals, so we are extremely pleased to hear that, and want to thank all of you who've been staying home and helping us flatten the curve here in Montgomery County. We have received a lot of questions about long-term care facilities, so I wanted to give you an update about that. Here in the county, we have 75 long-term care facilities that are licensed by the Pennsylvania Department of Health, so by the State Department of Health. The County Office of Public Health and the County Office of Senior Services have been conducting a coordinated effort to have daily contact with the long-term care facilities in the county to assess the real-time occurrence of COVID-19 in these sites. As of this morning, we have 34 of our 75 facilities that are reporting positive cases of COVID-19. We have 24 facilities that have between 1 and 5 cases. We have 5 facilities that have between 6 and 10 cases. We have 3 facilities that have between 11 and 15 cases. We have 1 facility with between 16 and 20 cases, and 1 facility with between 20 and 25 cases. In total, we have 140 cases that are in the residents of these facilities, and 53 cases that are staff members that work at these facilities. The outreach is being done to our hardest hit facilities in order to assess their needs and provide guidance based on the CDC and the Pennsylvania Department of Health guidelines. Our community-based testing site continues to be up and running today, and as always, thank you to Temple Ambler and the Temple University Police, to Upper Dublin Township, to our Pennsylvania National Guard unit that is there now, and numerous county departments that are assisting in this work. As of April the 6th, the end of the day yesterday, we have tested 4,204 individuals. We have 61% of the results back, and we are running 21% positive. Now, I did announce yesterday that sadly, the site will be shutting down at the end of the day Friday. I want to emphasize that it is not the county that is shutting down this site. As I've discussed from the very beginning, this asset, this site, was put up with help from partners at the federal government level and the state level. And the federal government in particular was providing the swabs and viral media test kits. The swabs have to go into a liquid media to preserve the sample while it travels to the lab. Not only were they providing the kits, they provided the contract with LabCorp to test 250 samples from Montgomery County every day that the site was open. And that is really the rate limiting step for us. We don't have any additional kits here in the county, nor do we have a commitment from a lab to take those samples and test them every single day. So we are extremely grateful for this partnership. By the end of the week, we hope to have tested just over 5,000 people. It has provided an enormous amount of data for us here in the county as we track this disease, and obviously given all those people some answers as to whether or not they're positive for COVID-19. But as you know, these are incredibly scarce resources, and we do not have a way here at the county level to make up for these test kits or make up for that contract with LabCorp. However, all of our county hospitals are now providing testing. That was not quite the case when we first opened this site. So there are places all over the county now where people can be tested. And remember that if you are healthy at baseline and you have mild symptoms of COVID-19 that you can manage at home, you should absolutely check with your healthcare provider, but you don't need to be tested. And we have been saying that from the beginning. You should self-isolate until you feel better. You need to self-isolate for at least 7 days from the first day of your symptoms. And then in addition, 72 hours need to go by that you've not had a fever without any fever-reducing medications. If you fall into that category and you're basically healthy, you're going to be just fine at home. Stay in touch with your doctor, but you should be just fine at home and you don't need to be tested. We really need to conserve the tests that we have for people with serious underlying medical conditions, who are immunocompromised, for our first responders and our hospital workers. Those folks need to be tested so we can figure out whether or not they have coworkers that need to immediately go into quarantine as well. So I know it's sad, we're sad about it too. I wish we had a way to magically produce more test kits, but we just don't, and that is the position that we are in. But again, very grateful to have had as much accomplished through this site as we were able to do. Registration for tomorrow, Wednesday, will open at 8 a.m. tomorrow morning, either online at montcopa.org/COVID-19. You want to click on the button that says County Testing Information and then click on Register for a Test. If you don't have good internet access or don't have an email address, you can call 610-631-3000 to make an appointment that way. We continue to work on the deployment plan and finalizing the site location for our SEPA Smart asset, which is the mobile hospital that we have talked about these last couple days. So still not totally finalized, and as soon as that is finalized, I will be sure to let you know. I just want to continue to remind everybody to do their best and stay home. We are heading into what we hope will be the peak of this, and that our peak is not going to get too much higher than what we're already seeing. Only time is going to tell us whether or not that is the case. The modeling continues to look pretty optimistic for the state of Pennsylvania as a whole. And what we're seeing in our numbers and what we're hearing from our local hospitals tells me that the vast majority of you are really doing a good job with staying home, that it is making a difference here. We still have beds open, and we are very hopeful that if people continue to stay home, no matter what you call 911 for next week, whether it's COVID-19 or you're having a heart attack, that there'll be a paramedic who can pick you up and there'll be a hospital bed for you on the other side of that ride. So please keep at it. This is for our entire community. Those of you who are young and healthy and think that you can go out, it doesn't really matter, that's just not true. Because you could be carrying this virus, you could be contagious and not realize it, and you could infect somebody else. So please, I know it's hard, but the way that we get our businesses back open, the way that we get people back to work, and our kids back to school as quickly as possible is to stay home now. And with that, I'll turn it over to Commissioner Lawrence. Oh, I'm sorry, Commissioner Gay.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. Today I would like to provide an update on new procedures for our Register of Wills office. The Montgomery County Register of Wills performs several functions for the public, including orphan court filings such as emergency guardianship petitions and emergency end-of-life or medical decision-making petitions. They also handle the collection of inheritance taxes for the Commonwealth, the issuance of marriage licenses, and the acceptance of probate petitions. The Register of Wills has been accepting e-filings since the beginning of the COVID-19 crisis. Inheritance tax filings and payments received by the Register of Wills are temporarily being backdated to a filing date of March 12, 2020. With regard to marriage licenses and the probate of wills, the Registers of Wills is utilizing a procedure for remote filings, which can include web-based video, swearing in of the oath in front of the clerk. We are asking that the Montgomery Bar Association help us disseminate the new informational instructions for marriage license and probate procedures. Additional information can be found on Montgomery County's website and social media accounts, so please stay tuned. For questions, please call 215-813-1400. Again, for questions related to the Register of Wills, please call 215-813-1400. And with that, I'll turn it back to Dr. Arbush.
Thank you. Okay, any questions?
How many patients do we now know are in Montgomery County hospitals? Do you have that number of just our local hospitals? How many COVID-19 positive?
I don't have it today. Yesterday, we think we had about 250. It's an approximate number, but we think it's about that.
And hospitals still have a number of possible cases as well that would or would not be factored into the 250.
I can't answer that with certainty. I don't want to speculate on that.
Do we have any more concrete numbers from the Limerick generating station of how many possible contractors or employees there have tested positive?
So our Office of Public Health is working with them now on a daily basis, sometimes multiple times a day, and they have so let me repeat the question. The question was, do we have any additional information on people at the Limerick generating station who might have either be proven to have COVID-19 or in quarantine? So our Office of Public Health is now in contact with them multiple times a day. They did, as of yesterday, begin posting numbers on the Limerick generating station page of their website. There has been some confusion because what's on that website is just what has happened since the outage began. But what I will share with you is that there are 3 people that have tested positive for COVID-19 since the outage began. 1 is an employee and 2 are contract workers. There were, though, 2 employees at the Limerick generating station before the outage started that tested positive. So you'll see, like in the Pottstown Mercury today and other places, they've been confirming that yes, there were 5 people total at Limerick that have tested positive. So it's my understanding that 2 of those were before the outage started. and 3 since the outage started. In addition, there are 44 people in quarantine. A number of those people, I believe 23, have signs and symptoms. I don't have any information on whether or not they've been tested.
Just one more real quick, because I gotta jump out for a last shot. Parks and trails, beautiful weather, people wanna get out, but we're seeing trails and things, and even people almost jumping fences at golf courses to get out. What do you do here? The governor of New Jersey is just shutting down parks, state parks and county parks to keep people indoors.
So our county parks have been closed from day one. And we talked a little bit about this yesterday regarding our trail system. I really want to keep our trails open, but we are hearing from our park rangers that people are not practicing social distancing on our Montgomery County trails. So we will close our trails if people can't practice social distancing on our trails because it's just not safe. So I'll ask again, if you are on a Montgomery County trail or any of our trails, please practice social distancing or we will close our trail system as well.
If the testing site, or when the testing site closes, you've been using that, is it correct to say you've been using that for EMS, police and first responders to get tested there, or are they going anywhere?
It really depends. Sometimes they go to a local hospital, but if no one else can get them in quickly, we've been using that. So our hope is that we've been able to offload a lot of testing from our hospitals and given our hospitals a little bit of breathing room. So now they're up and have more capacity than they did, almost 3 weeks ago now when this opened. So we're hopeful that they'll be able to accommodate those individuals.
So,
and if not, we will continue to work with the Pennsylvania Department of Health. If we have a very high priority individual, they can usually work with us to get us some testing equipment and then run it at the Bureau of Health lab that's in Exton. So we will have some other options for critical workforce.
last week you said you were concerned with the communication with Exelon. How would you describe where you are now with that?
The question is, how would I describe our communication with Exelon? It is much better. There is now daily, sometimes more than once a day, communication between the appropriate staff person in our Office of Public Health and someone actually on site at the Limerick generating station.
Yesterday you mentioned the letter to the governor. Is there any new developments on that? Or?
We've not received any response that I'm aware of on that letter. The question was, we sent the 5 southeastern Pennsylvania counties sent a letter to the governor yesterday asking he and Secretary Levine to consider implementing what's called load balancing across the Commonwealth, which means that we would, that the state would look at all of the hospital beds that were available, all of the ventilators that were available, and if we were getting very tight shape here, we would be able to then offload from them. So that was the gist of the letter that we sent to the governor yesterday, and we have not yet received a response from them.
And I've had a couple of people ask me, when might we know when we're on the backside? And I know it's...
I know, everybody wants to know, when are we gonna know? You know, the modeling still suggests that we're starting on the surge, and we've certainly seen an uptick in our positive cases here in the county. We have very sadly seen an increase in our deaths now for, we've had 5 deaths now a couple days in a row. We're hoping it doesn't get much worse than this for us. It probably will get a little worse before it gets better, but we hope that we're at that, sort of on that rise of the curve, and that hopefully that rise isn't too far from where we're at, or I'm sorry, the peak isn't too far from where we're at, but only time's gonna tell for sure.
And there's no way of knowing at this point how...
No. The question was, is there any way of knowing how long that's gonna last? I can tell you how to make it as short as possible, and that's to stay home. It's a simple answer to that. The more that people try to bend the rules, the more that people are out playing basketball, the more that people are out with people that aren't their household contacts, the longer this is gonna last. That's just how this is gonna be. Teresa, did you have no one else? Okay. And that's good. Okay. Then tomorrow we should be back at 3. Thank you.